Hi. We are here today with Dr. Gowri, who's a child developmental physician, and we're going to touch upon a few points where we talk about autism and early diagnosis. To begin with, I would like to ask we hear about autism, ASD a lot these days. Is it that more children are being diagnosed today than, in the past? What are your thoughts on that?
Uh, First of all, if we start looking at the incidence of autism, even in the start of this century, say in the years 2000, it was 1 in 100. But the recent data is saying it is 1 in 34. So, definitely the number of children who are on the spectrum is increasing. One could be because of the awareness, people knowing there is more developments that is going on in the field. So there's more awareness being created,
Yeah.
and how we are diagnosing, what we are doing is also improving. So definitely we are seeing a lot of
A lot more. So the
increase.
incidence has increased quite a bit, you would say. Wow. I
It's
mean,
exponential.
it's exponential. Yeah,
If
1
you
in
look at the
100 to 1
graph,
in 30.
if you look up the graph, it is exponential.
Yeah, no doubt,
Rise.
no
Yeah,
doubt.
talking
Yes.
about the rise in the number of incidents, but there's a sudden surge in the diagnostic things. So why is that, ma'am? Is it because of the better awareness or better recognition, or are the parents able to identify the signs and symptoms earlier?
There is a shift in how we diagnose autism.
Okay.
The latest version of it is coming under DSM-5 criteria. So it is well defined what to look at. There were 4 5 different categories like Asperger's, PDD, other
Yeah.
things as well. They've all come clubbed under one.
Mm.
So the more number, or there's more variety coming under the autism spectrum, hence the word spectrum. And also the screening. There are tools like MChat out there,
Yeah.
which is easily, freely available, which can be used even by laymen, which
Yeah.
is actually a boon, so we can pick up early.
Mm.
Okay, so these are one aspect. The other aspect, even with these things, we cannot explain the way we are saying there's a boom or a
Yeah.
high rise.
Okay.
True.
Okay.
There are so many changes happening around us.
Mm.
So something we are still looking into, all the genetic factors, where how things are changing. And the other is our environment.
Yeah.
One is the kind of pollution, what we consume, our
Mm.
lifestyle. Under lifestyle, a major factor that we are seeing now is the screen time.
Yes.
Yes.
And again, the way the children are brought up, the stimulation they are getting, it is all changed. So
True.
that is why there's an increase. It's not just because we are diagnosing more,
Mm.
it is because the real incidence of autism occurring is also increasing.
Got it. Got it.
True, true. And doctor, you spoke about there are a lot of changes and regarding genetics, diagnosis, everything. I would like to add one more question related to this. How do you see the modern childhood compared to the age-old childhood? Like, how is it different now?
With evolution, we have evolved.
Yeah.
Our lifestyles have evolved. So the family structure has changed. Now it is more nuclear families.
Mm.
Mm.
Being nuclear families comes with its own burden.
True.
So there's mother, father, children usually. There's nobody else to support.
Mm.
Mm.
And with the modernization, the stresses, both parents are working.
Yeah.
So the quality of time spent with the children is less.
Mm.
True.
And looking at the children's perspective, how safe it is to go out and play like we
Yeah.
used to
Oh,
in the
yes.
olden
Yeah.
days.
Yeah. True.
Correct.
Now
So
they're just at home, the whole time.
yes, and what to do being alone at home? Again, they get diverted,
Mm.
gadgets, they're meeting their friends online these days rather
Yeah.
than offline.
Honestly.
So when there is the break in that
Mm.
social connect as well.
Yeah. So that's one of the big differences I think from like back then. So I think you said something earlier, which is screen time, which is something that we've been hearing so much, and we know that virtual autism is obviously a myth, but there are a lot of people who are talking about how screen time does connect to developmental delays and maybe milestones being missed and the speech delays and things like that. So how do you differentiate between that, like what is caused by a screen, and true autism?
Screen time, as you say, has its own effects on children and development. It can
Mhm.
affect children in all aspects.
Mm.
One is their milestones, speech delay. The other is the social delay also. So they're a lot on the screen, they're not exposed or they don't know how to connect with others. So the social delays. The screen time itself can increase behaviors. So when we talk about behavior aspects in autism, so the social communication delay and behaviors,
Yeah.
what we are seeing, that is where they kind of try and
Sometimes children
say.
mimic what they see online, maybe like because they're not really used to the
One aspect is they're mimicking only that,
yeah.
but screen time itself increases aggression, having tantrums,
True, true,
meltdowns.
true.
So there's a wide variety of aspect how a screen time can affect children.
True.
And these days, when we look at screen time, also the children are getting exposed very young on.
Mm.
Even though the
Yeah.
guideline disagrees for various reasons, children are getting exposed to screen time early.
Yeah.
So it somehow correlates. They say by 1.5 year, the child is exposed to screen time, and that is when they started noticing this.
Got it.
And
Okay.
that is when we start noticing symptoms of autism as well, more clearly. So that is where this dilemma has come in. So, although screen time can affect or make the symptoms of autism worse, that is not the only reason. So
Okay.
even you have dilemma, whatever you believe, the what is important is starting early, identifying those problems early, and working on your children to get them to get better, stopping screen time and working on the skills where it is affected.
Where it's actually affected. So
Yes.
I think this is where you'd say early intervention plays a big role, and especially I wanted to ask, how does why is early intervention so important when it comes to being on the spectrum? Because is it possible that with early intervention we can maybe improve symptoms, or if not, if it's not there, can somebody get worse on the spectrum? How does it work?
So if you looking at how we can pick up, so even as young as 5 6 months, when you say social
Five,
smile, it
6 months.
usually
Okay.
develops between 2.5 to 3 months they have.
Yeah, they're supposed to smile.
Yes, so by 5 6 months they're not looking at you, not smiling or laughing at themselves. When you're trying to interact or engage with them, they're not smiling. That itself is a red flag.
Okay.
By 1 year, we say they can, when you see children, they can wave, hi, bye. When you call their name, they're looking at you, who's calling me,
Yeah.
or they say mama, baba, tata, some
Yeah.
single words they develop by 1 year.
Yeah. True.
Yeah. Yeah.
So if those not there by 1 year, you know.
Then you
By
know.
1.5 year, one single meaningful words they should be able to say. They point and ask.
Just
They
a
look at
small
you.
follow up. Like, doesn't this actually mean that? Because at 1 year, 6 months, and all, nobody has screen time. So clearly, this has nothing to do with screen time, right? Like when their milestones are being missed.
Correct,
Okay.
correct. So that is what autism, if it is there, even though we cannot pinpoint where exactly the problem is, it is there.
Yeah.
It's just not because they're exposed to screen time.
True. Understood.
Yes.
Yeah.
So
I
Yeah.
mean,
by
yeah.
one and a half year, things are
It
there.
should be diagnosed or it should be identified.
Yes.
Yeah, it
Yeah.
should be
So
recognized. Yeah.
yeah. So the other question about why we have to pick this up early, that is the other
Yeah. The
part you
main. Yeah.
asked me. So when we start early, okay, at that age of 1 to 2 years or even 3 years, when we look at the natural brain development of children, so even though their milestones are delayed, their brain growth is happening at the same rate.
Yeah.
By 5 years, we say 90% of the brain is developed.
Correct.
There's a time schedule at which, even though it is arranged, there are
Yeah.
schedules at which children develop skills.
Yeah.
And at that age, as the brain is still growing, so much connections are still happening, their ability to learn is at maximum.
True.
So when we start supporting them, we see better outcomes.
Okay.
Correct.
So we do see a difference in the progress of children based on how early we
How
start.
early? Okay.
Good.
So same efforts put a couple of years later, you need more to put more efforts to see the same change when you start earlier.
True, like how difficult it is for us right now to learn something compared to how easy it was back when we were young, you know? All these languages we learned when we were kids, we don't remember. Now, when we try to learn a language, it's like, oh my God, what's going on?
Correct, correct. So
Yeah,
their capacity absorb,
yeah,
their brain is a sponge at that time.
true.
Even though learning is still continuing, it's not the same as when we were
Mm.
younger.
Yeah, absolutely true, absolutely
So
true.
it
Yeah.
is important we start early.
Doctor, you spoke about delayed milestones. I would like to give an example. Let's say there's a parent. Though there are a lot of awareness right now, uh, the for the parents it is hard to accept that the child is undergoing something. And talking about delayed milestones, like 6 months, 8 months, by the eighth month, the child should be able to sit. The child should be able to crawl. The baby should be able to crawl. If not at the right time, there are chances that the parents will just not notice it, just ignore it, saying that until 1 year or 1.2 years the child will automatically do. So I would like to ask this question: is there anything like red flags that the parents actually ignore, or they forget to identify, or they don't know how to identify, and that can lead to a gap in diagnosing?
Yes. So when we were talking about awareness, there is increasing awareness, but still not enough
Mhm.
in
Mm.
all aspects in the community. So it is important. There are things called red flags. There's a ceiling at which we say this milestone is not achieved, this is not right, we have to work on the child.
Okay.
So we have to pick those things up.
Mm.
So for autism, we say by 6 months they should be smiling.
Mhm.
By 1 year, they should be able to do simple gestures.
Yeah.
Hi, bye, respond to your name,
Mm.
say a few simple words. If not by 1 year, by 1.5 year.
Yeah.
By 2 years, they should be putting two words together.
Mm.
Mhm.
Okay, and some
Absolutely.
of them you will hear that till 1.5 year they were doing fine,
Mhm.
but then suddenly they stopped.
Mm.
Okay, but even in these children, when you go back and look, it's not that it was completely up to the mark. There were some delays,
Mm.
but they may be looking at you, responding to your name, or some
Mhm.
may be calling out Amma or
Mhm.
waving by,
Mhm.
but they may stop suddenly.
Okay.
So,
Mm.
autistic regression, what we call.
Yeah.
So this is also very common.
Mm.
And especially when we were talking about screen time, sometimes
That can
this
add to
can
it.
Yeah.
incidentally or
Mhm.
coincidentally be at the same time. So they may start
Okay.
Okay.
blaming
Okay.
So
screen
then they
time.
correlate the two.
Okay.
Yes,
Yeah.
yes.
Mm.
But at least here, there is something the child was doing, and parents recognize and pick up.
Mhm.
Mm.
Uh, at least they recognize and pick up.
Yeah.
So that is there. And the other thing is, when such things happen, it is also important
Mhm.
to see are there other reasons that we are
Yeah.
missing out, causes that we are missing out when this regression happens.
Okay.
In children, in general, what we say is when they've developed a skill, if
Mm.
they stop doing the skill or they're not able to do what we call regression, it is a red flag in itself.
Mm.
There could be
Okay.
other reasons. They have to seek out professional help and make sure we're not missing out
Mm.
Yeah.
other causes for such
Yeah.
problems.
Mm.
Absolutely. Absolutely. That
Yeah.
adds up.
Yeah. So, ma'am, we understand that the diagnosis should be done as soon as possible, as early as possible. So, what about the diagnostic tools? Is there any improvement, or what are we following? Is there any innovation or improvement about the diagnostic tools?
There is a lot of research evolution going on in terms of
Mm.
why and how and what we can do about
Mhm.
autism.
Okay.
So, as young as 15 months, children can be screened with
Mm.
screening tools. Like how I already mentioned, MChat is
MChat.
out there. It is free.
Mm.
There's calculators where you just have to answer 20 questions and it'll give you a score.
Okay.
Okay.
All these the online
Oh,
free.
Yes,
Yeah.
we,
Okay.
so we
that's
need to
cool.
know how
Yeah.
wisely to use
Yes. Yes.
online
Yes.
True. True. I mean,
Mm.
it can be
rather
like.
than, yes, it is a double edged sword.
Mm.
Yeah.
So these things are readily available out there. And even in India, they have worked. AIMS has worked and
Mm.
developed a diagnostic tool as well,
Mm.
Inclin ASD, which is also easily available. They have modified. So, what we say DSM-5 criteria.
Mm.
So, we look at all the aspects
Mhm.
in that. And when this has evolved, there's more clear guidelines. And resources are still limited who can do this diagnostic test,
Mm.
but still there is outlets out
Okay.
which can be used. The screening can be done by anybody anywhere. So the
Mm.
MCHAT can be done between 15 to 30 months.
Oh, okay.
Okay.
Yes.
That's pretty early. Yeah.
Yes,
Mm.
pretty early.
Yes.
So with that, we will not diagnose them.
Mm.
Mhm.
They could be a risk. So we start working on the children, or even parents can start working on their children. We can guide them.
Mm.
Mm.
So if things don't improve, definitely
True. I
we
mean,
need
if you can
to put
start that
in.
early, it's all the more better to start that early, right?
Mm.
Like,
Yes.
wow.
So understanding that diagnosis also become so easy and so feasible, all that. And what about the comorbidities of autism? Do you see any comorbidities and co-occurring conditions like epilepsy or any dermatic conditions? Is there anything commonly that you see, ma'am,
Or
in
maybe
autistic children? Yeah,
gastrointestinal. Yeah.
gastric issues.
S- Again, when we say we may not be able to pick up the cause of autism,
Mhm.
Mm.
in certain cases they can coexist with other conditions.
Mhm.
Mm.
So, certain syndromes as well, which can be easily picked up with genetic testing.
Okay.
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 And especially with autism, we do see a lot of research is being done, a lot of EEGs are conducted
Mhm.
on children with autism. And it is noticed that one of the common
Comorbidity.
comorbidities
Mm.
is seizures.
Yeah.
Seizures. Okay.
Seizures.
So
So,
that's a
what we
common
say,
comorbidity.
it's common doesn't mean all of them have it.
Okay.
Among the
Yeah.
comorbidities, we do see.
Mm.
So where there's a, we are not kind of fully sure when a certain behavior is happening,
Mm.
why or what. So EEG is one of the common investigations
Done.
children
Okay.
have, and we have picked up a lot of EEG changes also
Mm.
in children who are on the autism spectrum.
Understood.
So the other aspects, when they are on the spectrum itself,
Mm.
they can have a lot of other issues. One is what we call gut issues, constipation. It may not be food allergies, but their preferences to what they want to
Mm.
eat
Mm.
or not eat, what we say
True.
sensory issues.
True.
A few of them can have intolerance,
Mhm.
but they have to be checked before
Okay.
giving a blanket
Mm.
Okay.
prescription for children,
Yeah. True. True.
blanket diet prescriptions. So the other problems that they face is also with sleep.
Mm.
So we need to look into deeper what is affecting the sleep.
Okay.
So the commonest is again the screen time and having routines,
Mm.
Yeah. And
our
not having proper
lifestyle.
sleep hygiene
Yeah,
and
sleep hygiene.
yeah.
So that if we put into kind of strict protocol follow and still there are problems,
Mhm.
we can help out with sleep issues as
Okay.
well. Okay, so it's
Understood.
about trying to understand where. And again, when sleep is not well, we are not eating properly, nutrition is a problem.
Mm.
They add on to the difficulties of managing children with autism
True.
True.
or
True.
learning as
Yeah,
well.
learning, I mean, definitely like this. It seems like it's always something that we can try and support from all these different angles. So, yeah,
Yes.
and if it does, then at least drastically we can manage it
So all aspects, when you say, that is what we have to look at the child as
as a whole.
holistic.
Yeah.
Mm.
So we look, it's not just the child is not talking, speech therapy will fix. We
Hmm.
try and look at different aspects, the areas like speech and OT, whatever we are
Yeah.
stimulating the child to learn.
Hmm.
These are the other aspects which can cause a break or delay their progress.
Correct.
So we have to look at the child holistically and
Mm.
work on all the
Mm,
areas
got
for
it.
the best outcomes for
The
the
best
children.
outcomes. So I think now we've talked about diagnosis quite a bit, and now we've just talked about looking at the child from a holistic perspective. So what would you, what excites you personally when it comes to therapy and diagnosis and this whole process of helping an autistic child? So what would you say is the part that excites you the most?
With therapies as well, it has to be curated for the needs of the child.
Mm.
Mm.
So we cannot say blanket sensory therapy. So we are working on all the
Yeah,
senses. So we have to pick out which areas is
a
a
child would
problem
actually
for
need.
that child, and where that child needs help, and the program has to be curated.
True.
And there's a lot of evolution even
Mhm.
in the therapy for such children.
Mm-mm.
So even when we say ABA or applied behavior analysis, the way it was done a few decades ago, where people are saying it is brutal and children who have grown up having it are having traumas. Now, the way it is done is different.
Mm.
And again, when we say it has to be curated for children, it is not just about making the child do something. The child should be able to use those skills to function into in their day-to-day
True.
natural
It should
environment.
actually
Mm.
help them
Yes,
and
when we say socio communication, so when somebody comes or a situation naturally comes, they should be able to function in that. So we
Okay.
need to make the
True.
child functional, is what we say.
Mm.
functional.
So it's not just the therapist working with the children.
Yeah.
That is where parent mediated, helping parents
Mm.
connect with their child,
Mm.
helping
Yeah,
them
coaching
know,
parents.
then them know what they have to do. So again, there are these kind of different models. So
Mhm.
one of them is the NDBI, where it is
Yeah.
naturalistic, so happening in the natural environment, and most of the time children are not with the therapist but
With the parent.
parents in at home in their natural environment.
True.
So they need to be functioning, so when they are on board, it is easier for them to understand and manage children,
Mhm.
and it is, we see it is more effective with the progress of the children,
Correct.
skill development in the children.
Mm.
Correct.
And sometimes there are so many aspects,
Yeah.
and parents are the best judge as well.
Mm-hmm.
So when they are empowered, there
Yeah.
is a big impact. We see the difference
True.
among the children we have.
Absolutely. Yeah.
Absolutely. And I mean, this brings me to, I mean, thank you so much for being so patient with all of our questions. But this brings me to this last question that for me personally does stick a lot. There is still so much stigma when it comes to a condition like ASD. So, what is the one message that you would like to maybe, or what is the one thing you would like to hopefully change when it comes to parents and schools and society, the way they look at these conditions?
Yes, so it is not a disease or a, like what we say mental disorder. It is a neurodevelopmental condition.
Yeah.
Mm.
Okay, so these are also children, they're also growing, their needs are a bit different, their
Mm.
understanding is a bit different.
Mhm.
So we as a society need to help support each other.
Yeah.
All of us are different, so all of us are diverse,
Mm.
Mhm.
but their needs may be a little bit more.
Yes.
So how we look at that perspective has to change. There is a lot of difficulties parents are facing. So initially, yes, therapies, but later what? Can they go to schools? Yes, they can go to schools. Some
Mm.
of them are academically so bright,
So bright.
and they have their strengths as well.
Mm.
So if we
True.
support them well, they can contribute in a big way to our society.
True. True.
Correct.
They can
Some of
help
the most like
each other.
genius people out there are people with autism, and I would say that they're eccentric for a reason.
Correct,
Yes,
correct. And we need variety.
we need.
And that is what makes us together.
Mm.
So, getting better inclusivity
Mm.
principles, accepting things, and knowing how what, coming
Mm.
up with better strategies,
Mm.
implementing them in the community. So it can be at home, it can be relatives, it can be school,
Mm.
workplace as they grow up.
Yeah,
So all this can help them. A lot of work still needs to be done. We have to continue.
yeah, we definitely. It's a forever process. It's not
Yes,
really once
yes,
it's done, it's fixed process.
correct.
True, true.
So
Thank you.
some social stigmas we have overcome, so we can overcome.
The others also,
Yeah,
yes,
we
yes,
will. We
we will.
absolutely will. I mean, strides
Eventually, we
like
will
this is
actually
how we
overcome
can do
that.
it.
Yes.
Yes.
Yeah, great. So wonderful, wonderful. Thank you so much, Doctor, for enlightening us with these thoughts of yours. And I hope that in the next episode, we can touch upon some better aspects, or like maybe we can talk about regression, which is something that I was very interested in. But
Okay,
yeah, on the
sure.
next episode, we'll definitely get into that.
No problem. And
Yes.
thank you very much for
Yeah.
having me here.
That's so
Thank you.
sweet.
Thank you,
Thank you,
Doctor.
doctor.
Thank you.
Yeah.
Yeah.